Hepatitis C is a viral disease that's carried in blood and causes damage to the liver. Most people get it through poor cleanliness of needles or equipment. It can also be spread through contact with someone else's blood. You can also get it from being born from a woman who has had hepatitis C. It can be passed indirectly by using a razor and then someone else using it right after you. Most transmission happened between 1970 and 1980 because doctors didn't have the knowledge they do nowadays. Many people got it from a blood transfusion. This was due from the plasma coming from multiple people, causing them to transfer the virus to other people. Currently, people often get it from tattoo and piercing needles, not being sterile before each use. The most common transmission is the use of drugs. These users are responsible for around 30 to 40% of infected patients. Even some cocaine users get it through the sharing of straws. It is unknown why heterosexual or homosexual people get this disease through the act of sex. In most cases, they can't tell where they got it from. Hepatitis C, or HCV, is a single stranded RNA virus. This virus is the cause of most liver damage and is still a problem today. It's thought to be synthesized by the replication complex, which consists of viral and host cell derived factors, in tight association with structurally rearranged vessel like cytoplasmic membranes. HCV is a leading cause of post transfusion to acquire non A and non B hepatitis infection. Blood screenings decrease the number of people affected by this virus. This is the leading cause of liver transplants. The strand consists of 9.6 kb of RNA. Only 40 to 50% of patients infected with HCV genotype 1 and 80% of those infected with genotype 2 bodies respond well to the treatment. This may lead to resistance of the viruses. Doctors believe cryosis may play an important role in the viral replication of the liver. Almost 3 million people are infected with this disease, and most of them are baby boomers. This disease lives in the liver and can cause liver cancer in some patients. Most people who have it don't even know that they have it. People who are infected with this disease will most likely carry it with them for the rest of their lives. The only way to be certain if you have this is to get a blood test done. Doctors use a screen test to see whether or not you have been exposed to HCV by detecting antibodies in your blood. If you have hepatitis C, there will be antibodies in the blood. Screenings are recommended for anyone who thinks that they may have been infected with this virus, but people born between 1945 and 1965 are offered a one-time free screening. Some treatments can get rid of HCV, but most of the time it doesn't get rid of the virus completely. Patients should take antiviral medication once a day to help stop the virus from multiplying. They didn't always use this type of medication. Up until about 3 years ago, they used interferon and ribavirin that was a weekly injection under the skin. This treatment caused a lot of strange side effects and often not successful in stopping the virus. Patients should take antiviral medications for HCV to help remove the virus from the body permanently and reduce the risk of liver cancer or failure. Antiviral medications help destroy the way the virus reproduces. Another good sign is whether it's no longer detectable in the bloodstream. Most of the time, treatment lasts up to 12 weeks and can go up to 24 weeks. Most treatments cure more than 90% of patients, but there are always the treatments that are not successful. There is no vaccine for hepatitis C. There are plenty of ways to prevent getting hepatitis C, such as not sharing needles or razors with other people. If getting a tattoo or piercing, make sure the place is clean and they open a new pack of needles in front of you. Try not to touch anyone else's blood without gloves, especially if you have any open wounds. Avoid usage. Be careful who your sexual partner is and talk about each other's sexual partners so you know if you need to be tested or not. Practice good hygiene such as hand washing and use of gloves. Getting tested regularly for all types of hepatitis. For those who are already infected, to seek counseling and get the knowledge you need to prevent spreading it to others. Acute hepatitis C becomes chronic hepatitis in over 70% of patients. Long-term infection is known as chronic hepatitis and is usually a silent infection. Most patients have either asymptomatic or non-specific symptoms, for example, fatigue or nausea. In cryosis, the symptoms are usually decompensated liver disease, such as sleep inversion and severe itching of the skin. Symptoms often involve in the joints, muscle, and skin. Other symptoms can consist of bleeding and bruising easily, poor appetite, discoloration of the skin, fluid buildup in your abdomen, and swelling of your legs. This agent is a positive stranded RNA virus, a viral antigen Wade used to develop circulation antibody. This agent of hepatitis C is one of the major causes of post-transfusion community acquired and cryogenic. It's a non-neutralizing antibody that develops late in infection and indicates that it's chronic hepatitis C.